And that is because biological siblings are going to be anywhere from 50 to 100% match, and normally anything that the stem cells carry is not necessarily going to be what the other sibling has. It's also been proven that stem cells from sibling to sibling work better than twice as likely to cure or help repair damage than bone marrow transplants from the same sibling. So other biological family members, grandparents, aunts, uncles, cousins, anybody directly related in that circle, there is the prospect that they can use them also. There's normally about a 25% chance that they would be a match. So kinds of uses. Right now, the biggest use for stem cells is going to be immune system and blood. And I have a few examples here of just some things that right now it has definitely been used for to treat everything from cerebral palsy. 3-year-old children have been given transplants on cerebral palsy. Diabetes on a 2-year-old, a 10-month-old for cerebral palsy, a 2-month-old with Wolman's disease, sickle cell anemia, aplastic anemia, X-linked hyper-IgM syndrome on a 3-year-old. Most recipients are very young. They mostly range from 2 years to about 10 years. So this is very good news for if you have a child already and didn't get the chance to bank their cord blood and you know that you're going to be having another baby. It's good to be able to bank at least one of the siblings' blood to be able to use for that child, or possibly their sibling. There are some other things that they're right now are just in the research phase. Some have been tested. A few have been used recently, but they're hoping that one day stem cells will be able to heal spinal cord injuries, brain injuries due to strokes, replace damaged cells due to the cardiovascular diseases, such as if you have a heart attack. Sometimes when you have a heart attack, part of your heart hardens, needs to be replaced. Also, everything from Alzheimer's, Lou Gehrig's disease, Parkinson's. They're finding that these are very viable treatments and possibly even cures one day. The past decades that it's been around, it's actually been proven to treat children and adults. Right now, it stands at almost 70 serious diseases. Right now, the prominent is leukemia. For some reason, it just seems to work very, very well with leukemia. And other basic blood disorders. Other benefits is that, again, there's improved outcomes when you're donating from sibling to sibling. It does seem to work out a little bit better than bone marrow. It's easy to obtain. There's no pain to the mother or the child since it's taken from the placenta and umbilical cord after it's removed. There's absolutely no danger to the child. Again, it can be stored indefinitely. And unlike the stem cells that are floating around in your blood and in the bone marrow, once again, stem cells are not going to be affected by the environment. They're not going to be affected by age. If you're 30 or 40 and you have cancer and you get a transplant for these stem cells, these stem cells are not really 40 years old. They've been around for 40 years, but since they've been preserved, they're in the exact same state as when you were born. And also, it's very easy access. You don't have to sit around and wait on a transplant list for weeks or months, some people even years, for bone marrow transplants. If it's cryogenically frozen, sitting there waiting for you, you could have it in a matter of days if you really need it. There are still controversies going on. Actually, the American College of Obstetricians and Gynecologists and also the American Academy of Pediatrics, both of them have spoken out against the private firms, and they said the best thing to do is to bank your stem cells publicly if you'd like to donate them. And that would create a worldwide, or at least a national bank. Now, there are other countries that are doing this, so eventually or hopefully it would be worldwide. This would improve the chance of somebody else who may be a really good match that's not directly related to you being able to use it. The downside to that is that if you donate your blood, that you cannot always get it back. If your child or your parent or somebody else needs it, it might already be used for somebody else. So there are some ups and downs to them. Again, like I said, there have been some instances where they did find that the stem cells taken from a child were not able to cure a child, that same child, when they had a disease. There are certain things that it can't do, and there are certain times when the stem cells can be affected by what the baby already has or is born with. The latest research tells us that right now, anywhere from 1 in 1,000 to 1 in 20,000 people would need a transplant for a variety of different things. You know, leukemia, anything. That's the average is about 2,700 to 1. However, if all of the research that has been done is correct, and within the next few years, things like Alzheimer's, Parkinson's, and all the other research goes through to where this has been found to treat or cure or even prevent certain diseases, the odds in being able to use this for yourself or someone else in your family actually go to about 1 in 100 to 1 in 2. So right now there are a lot of pluses, but there is still a lot of debate about it. In conclusion, you really have to determine if this is something that's right for you. If you are pregnant, if you know someone who's pregnant, if you know that later in life you're going to become pregnant, I do believe that this is an important decision that you should make. That doesn't mean you have to make this the decision to do this, but it's important. I think that everybody has this information. Cord blood banking can be expensive. It can run anywhere from $1,000 to $2,000 for the initial collection, and that pays for the sterile vials, that it pays for the doctor actually having to do the collection. You have to pay for the courier to take the stem cells directly to the research facility. They have to have people there to check it, make sure it's viable. After that, it normally ranges about $100 to $150 a year. If you factor in about 18 years, if you only keep it for 18 years, that's about $4,000 on average. But again, these are indefinite, so you could be paying on this for 90 or 100 years. Another reason to really consider if this is right for you: if nobody in your family has any major diseases or major illnesses, you're only going to have one child, and you don't feel that you need this, then it might be wise or consider it to donate it to public banking. It could be helpful or useful to somebody else. However, if you know that somebody in your family is suffering from Parkinson's or Alzheimer's, anything like that, or if you have multiple children, it could be wise to go ahead and store it privately and keep it around in case anybody in your direct family may need it. So that's my
All right.